Hey everyone, welcome to the interview and bench test preparation webinar by ASTA. Uh, Before we get started, I just want to go ahead and introduce myself and also the other panelists that we have today. I'm Anshita Venkatesh. I am currently an advanced standing 2018 batch at Boston University.
Hi everyone. I am Preeti. I am in advanced standing class of 2018 at Indiana University School of Dentistry.
Hi guys, my name is Arifa. I am the advanced standing class of 2018 at the Boston University.
Hi everyone, this is Mohit Jetani. I'm an advanced standing student class of 2018 at Boston University.
Hello everyone, this is Jyotsna Reddy. I am a past student at UPenn.
So the topics that we're going to be going over today are some of the common interview questions that you would come across, the do's and don'ts in an interview, how to ace an interview, what are the different interview models that different schools have. There are different requirements for bench exams at various schools, so we'll quickly just summarize those for you. And what are the different resources available to all of you for preparing for your bench exams? And what is the suggested practice timeline? When do you start? What should you be doing? And things like that. Also, key points on ergonomics. And we'll all share our personal experiences. And finally, we'll have the Q&A session. Okay, I'm sorry. Okay, so let's go over some of the common interview questions. Jyotsna, if you want to, talk a little bit about this. Okay, I think we might have lost Jyotsna. Okay, so I'm just going to start off.
Sorry. Okay. I was
there you go.
muted. Okay, so one of the very common questions they ask is, tell me something about yourself. I think it's more like a starting point to ask questions and follow-up questions. So I would say start saying something, from where you are, and they pick it up from there. Say something where you can talk at least for 3 minutes, okay, and you can go from there. I wouldn't really say, okay, talk this way, because everyone is unique, and just be very honest with this answer, because it just shows up, and it's usually the first question where you can, just create an impression. So yeah, it's one of the really important questions that you have to be prepared for. And one weakness, one strength, that's also something they commonly ask. Why our school? Just go through their website really thorough, because you just don't want to say you're applying to all the schools because you want to have a chance of getting into one of them. You want to be thorough, do your research, ask as many people as possible, and have your answers prepared. Don't be redundant. Just don't say go to a school where they're not big on research and say you really want to do your research in that school. Anshita, do you want to add something to that?
And Sheila, you might be muted.
Oh, I'm sorry, I was. So, yeah, I totally agree with what Jyotsna was saying that you should definitely look into the mission statement and the vision of the school because that is going to tell you a lot about the school. And they want to see for students who are, in keeping with that mission statement and that vision. So it's really important to have that. Some of the other questions that they're going to ask you is what are your immediate career goals and plans after you do the IDP or the AS program? Are you looking to, pursue residency? Are you looking for an academic career? Are you looking to be a general dentist? So they like to see if you have, your plans, your goals clear cut and know what you're doing, know what you want to do. That's good for them to see that. Interests apart from dentistry. This is one thing that I encountered a lot individually, especially because, they tend to say, okay, you know what, we know you went to dental school, dentistry, you're telling us so much about your entire CAPIT application talks about what you've done in terms of dentistry, but can you tell us more about you as a person outside of dentistry? So that's a really key point. So if you have anything to talk about for that particular topic, it's really useful. Apart from that, I would say you can talk about your work experiences. If you've practiced after your previous dental school, what kind of experiences you had, any key event that happened, any case that really, brings out some particular aspects of your skill, you should talk about that. Another important question that they can ask you possibly is if you have a master's degree, as to why you chose to do the master's degree and what makes you, want to come back to doing a DMD now. Like why you chose that path. You should be able to justify your path. And so if you have a master's degree, you should definitely be able to answer that question. And couple further questions would be what motivated you to come to the US? You should really, I know your SOP would possibly talk about that, but you should definitely, be able to give them a solid reasoning as to why you're applying, why you want to be here, what motivated you to get here. So yeah, that I would say is something that you should definitely be able to answer. Just anything else that you'd like to add?
Yeah, so one of the questions I encountered a lot is why should we take you? It's something, again, tell me something about yourself where you're trying to sell yourself. But it can be asked in this form too, where they're asking why should we take you? And another question they very often ask is, how do you think you're going to get integrated with the regular students who are going through, pre-dental and dental through the traditional path? Besides that, I've also seen people ask about, how many root canals you've done or how many crown preps you've done. Sometimes they ask this kind of questions to just be very thorough on whatever you're writing in your application. Don't say I did this research and not know more about it. You should be able to talk about it because you've done it. It's the same that goes even with C programs that you've done. Maybe you've forgotten about it, but just try to refresh your memory, just know a little about it, because I remember I was asked a question about a CE program that I did in 2010 about hypersensitivity, and I was kind of put on spot. Just go through those questions. This is not something you expect, but it's just good to be prepared for those kind of questions. And another question they normally ask is, why do you have low grades on your profile? You don't have to say something very negative. You can say that you had an event in your life, but don't say it like a sad story. Instead, say how it got you back on track, or something in positive sense. um, and another thing I've heard a lot is, if you say you're specializing, you're going to specialize in some particular subject, they ask you why. And just if for example, if you're applying to Penn, a lot of people say periopros. Just have a justification or how you work towards it or something in those lines.
I have something to add here as well. So one of the common interview questions that I encountered, not during my interview, but when I was talking to people, you may have years of gap, you may have a year, you may have 2 years, you may have 3, or more or less, but just be able to tell them as to why you have that gap, whether you were working on your application to get to the US eventually for a DMD or a DDS program, or you decided to pursue another course, which could be a master's and probably something to do with management or a specialty or whatever you're doing. Just like any other thing, be able to justify this as well as to why did you take that period off, why were you away for that time, or what you were doing exactly, and why should you now get back into dental school if it is a career change at all.
Okay, great. We could possibly go on to the next topic that we wanted to cover, which is how to ace an interview. If Kirti, Mohit, and with that.
I'll start. So, how to ace an interview. So, the first thing you guys want to know about is just be on time, and then you should know your CV, your publications, your personal statement really well, because they can ask any question with written in your application. You should not stammer at that time. Just be confident and talk to the point. Just don't waffle around and try to lengthen your answer, because they don't like that. You want to be crisp and clear about your answers. And another thing I have seen people doing, that when they go for an interview, they just sit alone and they don't talk to people. That's not a good sign. Um, some of the schools actually ask their students to go and interact with the interviewees, and then they ask the feedback about the interviewers. So just make sure that you are talking to the interviewees and the professors and everyone, and try to ask as many questions as possible, but don't ask any question which doesn't make sense. Don't ask questions which are already there on the website, because it doesn't show a good attitude from you. It means that you have not done your research properly about the program. Whatever is mentioned on the website, never ask that, and ask different questions which you would like to know about the program, which has not been mentioned anywhere else. That's pretty much it. Mohit, would you like to add something on the top?
Sure. So Kirti did touch on the fact that you need to know your CV in and out. The other thing that you do need to also know in and out is your personal statement. Um, well, you've got to keep in mind one thing, that you have been invited for an interview because they already like you, right? So they're going to ask you questions based on your personal statement that has to correlate with the person that you are. The interviewer does not want to be in a position where what he's read and the image that he has about you as an individual does not match with the person that he is seeing in front of him, right? So that's one of the key areas that you need to keep in mind. Be confident, just because of the fact that, like I mentioned, they already like you. What they are here to see about you is also whether you are a good fit for the school's environment. That is why they want to see you in person outside of whatever the interview process, whatever the interview process may be like, whether it has a bench exam, whether it does not, which we'll get into later. But they want to see if you're a good fit for the school's environment. Also, this is your opportunity to gauge the vibe of the place by asking questions to the interviewer, by asking questions to student hosts, trying to get a good understanding of what the environment at the school is like, and match it with what your expectations are, what your background is, because it's really important that once you do get accepted and go to a program, you are happy and content over there. Yes, it's a stressful time where you want to get accepted, but just remember that if you are good enough, you will get accepted not at one place, but maybe at multiple places. So that's one part about it. The second part that you want to keep in mind is on certain occasions, there will be some interviewers who will put you in a tight spot. Now, the only reason that they do that is because they want to see how do you react in that particular situation. It's not because they're sadistic and they're getting pleasure out of it, but that's their way of simulating real life scenarios where you might be in a tight spot when you're actually seeing a patient in the school clinic. Yes, you do have faculty supervising you, but again, that's their way of gauging what kind of an individual you are and how good or not so good you're going to be with regards to handling patients. So these are a few things that are kind of offhand, but they're very important to remember. Also, make sure you're very well dressed, well rested, and grab some breakfast before you get to the interview, or at least a cup of coffee. But yeah, I guess unless Kirti has something else to add to it, maybe we're ready to move on.
Jyotsna, do you have something to add to that?
Just the last point, make sure you send thank you notes to people. When you're interviewing, make sure you take down the interviewees' names so that you can write an email to them. And don't write the same email to everybody, especially if you're having different interviews. And don't just say, okay, I came to your school, I really liked it. Add something that was more unique to your interview, something that reminds them that you were that person who they interviewed, and that just strikes this impression, and it might leave an impact at the end of it. Besides that, I don't have anything to add.
Okay, awesome. Thank you, Jyotsna. Let's go over the different interview models. So I think if Arifa, Mohit, and Kirti can talk a little bit about these different interview models, that would be great.
Okay, I'll touch upon, this is Kirti. I'll touch upon University of Michigan first. So Michigan has a unique interview style. It's multiple mini interviews. So you give four small interviews, and each interview is of 5 minutes. They make you read a question, and which takes about a minute, and make you think for 30 seconds, and then you have to spontaneously answer. Questions are typically based on ethical base, political base, and that's pretty much I can talk about. And so just be prepared. So the trick to multiple mini interviews and these questions are, when you read the question, don't take any one side. You should always say pros and cons of both the sides. That makes more sense when you are answering those questions rather than just talking about the pros of the side you are talking about. And then second, I would talk about is Indiana. Indiana is one-on-one interview. It's just a conversation you're having with the interviewer, and it's pretty basic. They talk about your CV and your personal statement and your experience, which Ansita and Jyotsna have very well explained how to answer those questions. Just be prepared. Try to practice. Like they say that like you don't want to mug things, but try to practice in front of the mirror. It just gives you more confidence on the interview day. I feel it really helps a lot. And then there is a written exercise in Indiana. They give you a ethical based question and they ask you to write it down. They don't basically judge you on that, but they just want to see whether you can write things in a English language or not. That's pretty basic. And same goes with the Loma Linda written exercise. It's pretty much the same. So Loma Linda has a one-on-one interview again after you pass the bench test, and it's pretty basic. Talk about your CV, your personal statement, and that's pretty much it. And then Colorado is unique. They have 4 people in the interviewers. 2 are the current students. One would be D3, one would be D4, and 2 are the faculty. They pretty much ask everything. They ask you ethical based questions, 2 or 3. Then they go about your CV, your personal statement. They actually ask everything in your CV, like what you presented, what are your findings, and everything. So be very thorough with your CV when you go to Colorado. And yes, and next I think Mohit would like to talk about the other schools.
Sure. So I'm going to talk about Minnesota, Nova Southeastern University, and Boston University. Now, Minnesota is unique in terms of their interview process, where it's a combination of both mini interviews and a full-fledged interview. There are 3 faculty members who you will interview with. One of them may or may not be related to the School of Dentistry altogether. They might actually be from School of Public Health or the School of Medicine. The second faculty member will have a prominently or predominantly research background. And the third interview would be with the program director. Typically, that is the interview that goes on for the longest. That is not to say that either of the interviews have any lesser or greater weightage. As far as their bench test is concerned, again, it's a little unique where they have a DentSim psychomotor skills assessment where a software is hooked up to a mannequin where you have to make a class 1 prep in about 10 minutes. It's a very basic prep. They make you practice over there for about 10 minutes, and it's the most straightforward cavity preparation that you will ever do. So it's very different. There's no way you can practice for it, which is why I'm touching on it over here as against in the bench test section. But again, like I said, you don't have to worry about it. It's the most straightforward one that you would encounter. When it comes to Nova Southeastern University, you will be interviewed just by one faculty member. It can go from anything from 5 minutes to about half an hour. And then you have the bench exam. With Nova Southeastern, though, the bench exam is what is the most critical part of whether you get accepted or not. They have very minimal weightage given to the personal interview. It's mostly about how you do on the bench exam that determines whether or not you get accepted, waitlisted, or worst case scenario, declined. Boston University, there is no bench exam. It is only a one-on-one interview with one faculty member who then gives a write-up to the admissions committee, which is comprised of anything between 8 to 10 people, who then decide based on your overall profile, the feedback that the interviewer gave them, and the overall assessment that they made about you as to how good a candidate you would be potentially for their school. Arifa, do you want to go over the other universities?
Yes, so I'll be speaking about UCSF and USC specifically. These 2 schools are, the USC is specifically going to be doing an interview along with a bench test like USC. UCSF has two interviewers who would be talking to you in person. Both of them mostly would be dentists, and they will be faculty members for the most part. The in-person interview usually lasts about 30 minutes for a maximum of 30 minutes. The way it usually works is you'll be given, first you'll be asked, you'll get all this information in the mail that will be coming. It'll be a manual that will come from UCSF in the mail. And basically it's a one-day interview. They'll give you every information that you need to know, where you need to line up, where you need to meet, what floor, exactly where. And Miss Pham, I believe, is the admissions coordinator. She's available there. They're really helpful. They're nice. Once you line up, you'll be told whether you'll be going in for the bench test, which is for the most part always the first component which is covered. When you walk in for the bench test, there'll be a faculty member who will be in charge. There'll be students, current students who are in the IDP program, who will be constantly on the rounds there in the simulation lab, making sure you have everything that you need. You have all the materials. So UCSF, I must say that they do not ask you to bring in any bench test materials with you. They provide almost everything that you need. You just have to show up, interview, and get accepted, if I may say, and you just have to go ahead. I think what I was asked when I was interviewing was a crown prep for upper maxillary canine and a crown prep for the mandibular left first molar. They're relatively simple. It's a very relaxed environment. They do not put any pressure. It's no stress. It has a beautiful view, if I may add to that, the simulation lab. They will, that is the first aspect. As soon as you finish, whenever you do, there's a short break. You'll be divided into groups eventually for the in-person interview. You'll be assigned to groups, and there'll be two faculty members waiting in the specific room that you are going to be interviewing at, and they have all of your information. Like most other interviews, they have your CV, they have your transcripts, they have all your I-20s from your previous schools. Everything about you is already present there. So look at it this way. They already have you tested for your clinical skills. They already know where you stand based on that once your bench test assessment has been done. What they want to really see is, besides the clinical component, what is it you bring to the school? What's your personality like? What has been your past experiences? That is what is the in-person interview about. It is situation-based. They also allow you to practice. You just have to book you have to let them know that you'll be coming in. They're generally available for the most part. You just have to go in and practice if you need to get comfortable there. They're very flexible with all of that. So yeah, that's about UCSF. I'll be glad to answer any other questions when you have them. Talking about USC now. USC has a different kind of an interview pattern. It has group interviews, which is mostly taken by people who are not dentists, from what has been my experience and what I heard while I was interviewing. They are not dentists, they are faculty members. I'm talking about the in-person interview here. They also have the bench test, which I'll talk about in a little bit. The person in charge when I was interviewing was Mr. Corey Berry, I believe. He is really nice. He will answer all your questions. Their information comes in with the date, so it's a 2-day interview. They have an email which is saying, congratulations, we're inviting you to interview with us. These are the dates. Be available for these 2 days, and when you go in, you'll again be tested. You'll be told whether you'll be taking the bench test first or you'll be going in for the group interviews. The bench test here requires you to bring all the materials. Now the email that they send you will have, what I had was a Dropbox link. The link will have every information about everything that you need what kind of a typodont you need to carry, what hand instruments, what you need to do a wax carving here. You used to need to do a wax carving here is what I remember doing when I was interviewing here. So you need to carry your own wax blocks, your carvers, your hand pieces, everything is what you're going to be taking in for the interview. So go prepared for that interview. That way you can practice at home. I don't think they allow the simulation lab to practice as opposed to USC. And the simulation lab is nice. There's mostly faculty. From what I remember them being, mostly they were prosto faculty who will be around there to help you to answer questions, check you in. Anything else that you have to figure out, they'll help you do it over there. They ask you to bring in calibrated typodonts so that they're in occlusion. They may use big words, just make sure that your typodont is in occlusion when they say it. They have the whole manual coming in the Dropbox link. Read the email, it has every single bit of information. Yet you can go back and forward with Corey and he'll answer all your questions over there. Then the second part of this interview would be your group interviews, where you'll be, from what I remember, roughly about 8 to 10 people in a room. And I interviewed with Corey himself. He was so he just is a passive part of the interview. He's just going to stand in the corner there while you're sitting around a table, the 8 to 10 of you. You'll be given a placard to hold in front of you so that everybody knows everybody's names. You'll be given a situation, you'll be given a story that this, for example, my case was that this lady she's traveling to so-and-so place, she has a case of food poisoning, etc., etc. They're not looking to find out about your medical knowledge. They are not doctors, they are not physicians, they are not dentists. They want to see, again, the non-clinical aspect of your personality. They want to see what else you're bringing into the school, your body language, how you speak. So try to be, try not to be aggressive, try not to be passive aggressive, try to be very positive about when you talk, try not to use very harsh terms, try not to use a lot of medical language there. Talk like how you would discuss amongst your friends who are not dentists in a very layman language. Although I'm not saying that you really have to break down things to simpler terms. It's not so. It is just easier if you use regular language instead of any jargons over there. Besides that, what else do I have to say? Yes, the bench test, of course. Once you finish your bench test, you will turn in your typodonts and they will be handed over to you the next day. If you're not available for any reason, not local to LA, flying out or anything, they will allow a friend or anybody else to pick it up for you and eventually they can mail it. Also, what USC allows is for you to rent out the instruments from their bookstore. Although I must tell you guys that it turns out to be a little more expensive. If there is no option, go for it. Or if it fits your budget, you're okay doing it, just go for it, rent out the interviews. Otherwise, you can carry your own, whatever you're comfortable. They'll give you a whole entire list of instruments that you need. I recommend you carry them unless it's really hard or you cannot pay for them. Borrow. There are always friends you may have in NL school. I borrowed a few things from my friend at another school and it just works out fine. I guess those are the two schools that I will be talking about.
Okay, so I'm just going to add a few things about a couple other schools and their requirements that they have. So for University of the Pacific, they do ask you to do a crown prep and an operative, which is usually a class 2. You're not allowed to bring in any material except for your loops. The bench exam also does have a critical thinking component where they give you a case and they, ask you, oh, how would you treat this case? It's pretty straightforward. And another school that I want to talk about is Howard in Washington, D.C. Their bench exam does contain an endodontic component, which requires you to prepare access cavities and also just initially clean and shape it on natural extracted teeth. It also there's also an RPD design component during the interview. Those are two points that are a little different from a couple of other schools. Probably let's go over the different resources that are available for you guys to practice for bench exams. Jyotsna, if you could go over that.
Okay, so I took classes. I went to Duggans. I'm not really promoting one particular thing and asking you guys to follow it, but it really worked out well for me. I went for a 7-day course at Duggans, and they taught me how to prepare onlays, inlays, class twos, um, crown preps. It was what was really helpful was just to critique myself. I just learned how to critique myself, time myself, and I did meet a lot of people who were applying for school. Before that, I didn't know anybody who was applying. So I got a lot of information about different schools from there. I know all these people that we have listed, Dr. Tools, Alyssa Marshall, Richard Stevenson, they all have really good courses, I'm sure. I can't speak for anyone, but what I can say is any of these bench test classes are useful. But at the same time, what is most important is that you put in, some hours of practice to it. Don't wait for you to get an interview call, or don't wait to even start applying. Start practicing. Most of us take at least 2 years break because we're giving all the national board exams and preparing our application. Meanwhile, you don't want to lose your hand skills. Just keep practicing. That is the key. And buy a compressor at home. You can sit and practice. Just buy a normal handpiece. You can even get it from eBay. Have a few burrs that are needed. Just go through the list. If you can ask anyone who interviewed what are the most common burrs, because I was in India and the numbers that we used there were quite different from what they use here. So you can ask people. Another thing that really helped me was just sending the pictures over to the students who are already in school, just because they know how the preps are done. They can critique you. That really helps a lot. Practice is the key. I can't stress on it more. Anshita, do you want to add anything else to it?
I think Mohit wanted to add something to that. Mohit?
Right. So one of the things that is a very useful resource is actually YouTube. University of Michigan has a lot of videos that they have uploaded on their own channel. So that's something that you can really utilize to your benefit. Outside of University of Michigan, it's YouTube. You will find a lot of videos. Um, but again, that if you look up the videos that University of Michigan specifically has put up, it should give you a good sense of what is it that the schools are looking for in terms of criteria and how they're possibly going to be evaluating. While those videos don't specifically talk about evaluations, they do list out what should and should not be there in a particular prep, be it a cavity prep or a crown prep or other anything else that is part of the bench exam.
Okay, awesome. Thank you. So before I just talk a little bit about the suggested practice timeline, I just want to add that SDN, or Student Doctor Network, can be a very good and useful tool, as well as something that can cause a lot of anxiety. So please use your discretion when you're following all those blog posts. It can cause a lot of anxiety. There's a lot of speculation. There's a lot of rumors. So don't panic. But there is a lot of good, useful information out there too. The same thing goes for Facebook groups. There's a lot posted on there. So just I understand that, you're nervous, waiting for interview calls, and what about, the bench exam? I was too, but just be, very careful about, just believing anything that you read. Okay, so going further about this just a timeline, I cannot emphasize enough. I mean, you should not wait till you get an interview to start practicing. That, according to me, is one of the biggest mistakes that can be made, is to wait to it's like, I'll wait, let me get an interview. If I get an interview, I'll practice. I think that's something that, doesn't really work. You should be practicing from the day one. Like once you've decided, okay, this is what I want to do, you want to be working towards that goal. So you should be practicing every day. You can just do one prep a day, or just practice continuously. Avoid taking long breaks. Don't practice for a month and then just have no practice for 3 months and then go back to practicing again. Just perseverance and continuous practice, I think, is the key to success here. And like Jyotsna said, ask for critique. Working with a friend, or somebody, if you know somebody who's in dental school already, or if you're volunteering as a dental assistant or just shadowing a dentist here in the US, show them your preps. Ask them for any sort of critique if they can tell you, because they know what sort of preps they look for here. What are they looking for in the prep? So have them critique it. That, I think, is really important. Yeah, so Kirti, do you want to talk about the ergonomics?
Sure. So one thing I would like to say, that just make sure that you are sitting in the right posture. Some of the time when you interview at certain schools, there are students who are looking at you, and they actually make the point if you're doing a very awkward posture or anything. So just make sure you're sitting upright, and your feet are on the floor and it's 90 degree, your back is not bent. I would certainly say try to use loops. I know many of us in India or some different country have not used the loops, but then if you start using it, get the hang of it. Try with 2.5x magnification. Just don't go over 5x or 3x. You will never get the hang of it. Always start with the 2.5x magnification. And my recommendation would be, just don't buy any loops from the Amazon $50, $25 loops, because they don't help you. Like, their quality is not that great. I would recommend you to buy a good loop. Ask your friends in a dental school if they can help you and get you a student discount, and then you can buy from them. Or if someone else is selling on the Capit, Facebook Capit page or anything, just try to buy from them. And I would definitely recommend to buy a light. I feel light is more important than loop, because most of the time you're not able to focus the light on your preps, and then having a light is the biggest factor. It definitely increases your visibility and accessibility. You can buy the cheap ones. You get a $35 light from Amazon. It's not the best light in the world, but then it does serve the purpose. Try to use that, and if you like it, you can go with the Luminance. Tell them you are a student. They offer you a discount, and you get it for like $400. But if you don't want to buy an expensive one, cheap one is fine, and get into a dental school and then buy from someone, some loop company, and then get a student discount. That would be my recommendation. But try to use loops and light. It does help a lot. Yep, that's pretty much it.
Awesome. Kirti, do you also want to go over your personal experiences of, getting to the IDP program at Indiana?
Sure. So I interviewed at Indiana twice, so I never lose hope. That's my first sentence would be, because I applied for like almost 3 times. First time it was just one school. I got an interview from Colorado. Second time I applied to almost all the dental schools, got like 4 interviews. And last time I applied to like 9 schools and got like 6 interviews. So just apply to all the dental schools, not all the dental schools. Like you should know your basic requirements. Like if some dental school have 5 seats, just make sure that whether you want to apply or not, because it requires money and everything. And getting into a dental school requires both. Your application should be strong, but you should really, really present yourself well at the interview. And just practice, practice, practice. Practice both for the bench. Never wait for the interview call. Practice from the first day. Get if you don't know crown preps or anything, my suggestion would be to do a course, maybe Duggan or something like that. Make sure you know how to critique your crown preps, and then start practicing. And always practice for your interview. Uh, it You're not mugging the answers, but it just gives you more confidence when they ask you the same question. That would be my suggestion. Mm-hmm. Ankita, you want to talk about it?
Thanks, Kirti. Jyotsna, do you want to share your personal experience?
Sure. So when I applied for my first cycle, so I got in my second cycle. In my first cycle, I applied to a lot of schools. I had no idea about any school. I was just randomly applying, looking at their application fee mostly. Um, I did not do my research. It was my first year. I had no idea about schools at all. I got an interview call from Loma Linda and Colorado in my first cycle. At Loma Linda, I got through the bench test, and I did the interview and I got waitlisted. And then I got interviewed at Colorado, which I did not get in. After my first cycle, what I realized is that when I came out of the interview, I was not the person I am during the interviews, because I was talking everything like something I really wanted them to like me. I would say all flowery things, which really did not say much about me at all. Um, in my second cycle, what I was very clear on was the kind of schools I wanted to apply. I applied to 8 schools, um, and I built up my profile with experience, like dental assisting, some research. I did a lot of volunteering. I was volunteering at a school as a teaching assistant. I was teaching CPR. Um, and I just had a variety of exposure with people. I just learned how to speak to strangers. That really helped me during my interviews, because I could go talk to anybody and be comfortable with talking. So one of the, if you're a shy person, just try to talk to people. First of all, you're going to be in a healthcare profession where you're coming across a lot of people every day. Just try to converse. Don't hesitate. It's a new country, yes, but it's just all, it's just people. So try to talk to people. Um, Secondly, bench test preparation. Just try to practice as much as possible. I think that's what helped me in my second cycle. Um, my profile and just practicing for my bench test and just presenting myself as I am. Um, I got 4 interviews. I got interviewed at Loma Linda, SIU, UPenn, and Buffalo, and I got through all the schools. I think the key was that I was probably presenting myself as a more honest person. I was not cramming my answers. That's another thing that I did. I just read all my interview questions the before day, and I was trying to say everything and try to memorize everything and say it. That definitely might have come out as, rehearsed answers. Another thing that I did was one day before the interview, I wanted my friend to take my interview, and um, that kind of put me down. Not that my friend did not correct me, it's just that when she said this is not the way to answer, or try to answer this way, it just made me so nervous about, the kind of answers I have to give. So the next day when I went for the interview, I was trying to think, okay, am I saying it right? Just say your personal experiences. Just be truthful. I can't stress on it enough. It's really important to be honest. And just talk about something outside of dentistry as well. Just don't talk dentistry all the time. Um, and as we spoke earlier, just don't ask questions because you want to ask questions, and don't put in extra effort to stand out in the crowd. It's okay to blend in with the crowd, and it's okay to shine, but just don't try too hard to please everybody. Just be yourself. If anybody else want to add anything to it.
Raifa, do you want to share your personal experiences of getting to the AS program?
Sure. I'll start by saying that Jyotsna, I could not agree with you more. She is absolutely and 100% right. I remember when I was interviewing, I was asking people as to what kind of questions. I was looking up in Google. I was trying to find out, looking up by the school name as to what school will ask what kind of questions. SDNs, Facebook, every possible resource that I could get to, I could put my hands on. I was looking at every single one of them. And as informative as they could be, they could just be equally misleading. Do not get stressed out. Do not try to please people. The one thing I was told was just be yourself, go for the interview. And I'm sorry, but I do not know what you mean by just be yourself. But Jyotsna is right. Don't try to please people, although do not try to be coming out as negative in any way. Don't try to look like extremely desperate that you need this. We all understand it's important. It doesn't mean that if it doesn't happen with your school, it's not going to happen and life is going to end or anything like that. It's a part and parcel of life. Take it as an experience. Try, really, I mean it, try to be yourself. Don't try to please people. Try to put a good impression. Try to strike a good conversation. Does not really have to be dentistry related. It does not have to be with what your experience in the field of dentistry has been like. How many crown preps, how many class 2s, how many extractions. I know you'll be told that they'll ask you for numbers. Let's face it, we do not exactly have numbers, and sometimes we are not entirely honest about the numbers as well. And I'm not on the back end, but I can tell you that they know that you're going to be bluffing plus or minus a little bit over there. So just be honest. Tell them what you're looking to get from that school. Tell them what is your application like. When you've put things down in your SOP, when you've put things down on your personal letter statement, if you've put things down on your CV, know what you've put in there. If you've done a specific CE course, why have you done it? Tell them why you've done it. When you've done a master's, explain as to why you've done that master's. have a good reason for it, not just because I was bored or I had nothing to do or I was just looking for something different to do. Just have a good reason behind it. The personal interviews, the group interviews are more to gauge you on your critical thinking or your personality, not so much on your clinical aspect. These are the schools that have bench tests, which most schools do. The schools that do not have a bench test already have your credentials laid out in front of them. The reason you're being called for an interview is because you are worthy of an interview. You do deserve to be heard. So you're already there. You've already made an impression. All you have to tell them is that you are a well-deserving candidate, and that, which is why you're here. The schools that I interviewed at, when I go back and think, in retrospection, they've all been interviews that were very personable. People are really nice. They calm you down. It's not nerve-wracking. They are not looking to, get any numbers from you. They're not looking to get. You may think that you're a very average candidate, but you know what? There are going to be many like you. I don't think I was extraordinary. It's really about how much they like you, how much you think you can bring to the school. So it's going to be a lot of that. It's keep your calm, and as hard as it is, and it's easier said, just be yourself.
Mohit, do you want to share your experiences?
Sure. So one thing that I do want to talk about is for folks who have a research background, it is really important that you do know what your research project entailed, irrespective of whether it was your own solo project or if it was a part of a project that you had been assigned, or if you were just working as a research assistant or even as a lab technician. Do not tell them that you did something more than what you actually did, because there are folks who work only as lab technicians on big projects and then try and project it otherwise. That is a strict no-no, because like I mentioned earlier, usually if you have multiple interviews, there will be some or the other individual who has a strong research background, and they will be able to gauge in terms of what you had been doing during the time that your resume says you were doing research, as to whether what you're saying is even possible to accomplish or not. So that's something that you need to keep in mind. Outside of that, I think the ladies did cover most points that you want to keep in mind. So I'll talk specifically about interviewing at schools. As far as Minnesota is concerned, you're going to be in contact with Miss Janet Campanaro. That's the admissions coordinator over there, and the day runs pretty smoothly. You interview in you divide it into two groups. You either interview first and then have the psychomotor bench assessment, or you have the psychomotor bench assessment first and then do the interviews. You're usually starting at about 8:30 in the morning and get done by 3 p.m. I also interviewed at Colorado, where, as Kirti mentioned, you're interviewed by a panel of 4 members, 2 of them faculty, 2 of them students. Again, a similar situation where there's a large group of interviewees who are divided into 2 groups, where you might be doing the bench exam first, or you might be doing the interviews first. Irrespective, it doesn't make much of a difference what you do first and what second. One thing that you do want to keep in mind, though, is they have specific points that are allotted to each process. Their holistic approach of evaluating an applicant is one that has 3 set of criteria. One criteria is your application that they have in front of you, how strong it is in terms of your experience, be it research, grades, work experience, educational experience. The second part of your evaluation is how well you do on your bench exam, and the third part is the interview itself. Now, if you are a candidate who has an outstanding application and are amazing at your personal interview, it is very much possible that they do not look at your bench exam as critically as they otherwise would. I'm not saying it doesn't count for as much, but if you have two of those criteria where, let's say, if they're grading you 100 and you're in the high 90s, then the third one might be something that you do not have to stress about. The next school that I do want to talk about is Nova, where the day pretty much starts with you interviewing. Well, you get a tour of the school, which is a part of most interviews, but at Nova, that's the first thing that goes on. You get a tour of the school, you interview with one faculty member, and then during the afternoon, you have the bench exam. Now, one thing that you do want to keep in mind about Nova is that they use a typodon that is different from all schools. So that's something that you're going to have to buy separately and practice on if you are deciding to apply to that school. Lastly, at Boston University, like I mentioned, it's a one-on-one personal interview, and that might go on for anything between half an hour to 45 minutes. And at all places that I interviewed at, one thing that I did unfailingly notice was that all the interviewers are extremely personable individuals. They try and make you comfortable, and they try and make it as stress-free as possible. They do understand that you are nervous, and especially if it is one of the first interviews, if not the first interview that you are attending. So they might even ask you this question as to whether or not you've interviewed at any other school and whatnot. So just be relaxed and be confident and be as stress-free as possible. Yep.
Thank you, Mohit. Just a little bit about my personal experience getting to the AS program. Like the others said, don't lose hope. There are times where it gets tough, especially when you're waiting for interview calls. It can get frustrating. I've been there. I know that it can get very, you can get very anxious about it. But the key is to stay positive, perseverance, and practice. I cannot stress enough, practicing for your bench exams is really important. But also what I want to point out here is the first time around when I applied, I was also told that, the bench exam, and I did not have too much practice with doing crown preps. I was like, okay, I need to work really hard on my bench, and I thought, okay, I can totally like breeze through the interview. It's going to be a very personal interview, is what everybody says. I can talk my way through it. Surprisingly enough, my first school that I interviewed was Indiana, and I cleared the bench exam, but I didn't clear the interview aspect. So what a lot of people tend to forget is, yes, you need to practice a lot for your bench exam because those are your hand skills. But the school is also looking for somebody who would be a good fit for their school, personality-wise. Skills are something that they will teach you in school as well. Of course, they want somebody with good skills, somebody who's practiced. They see that, but they understand that you can get nervous on the day of the exam, but they like to see a good personality. They want to see somebody who can hold a conversation. They want to see somebody who is not fake, who is very real. So if you don't have experience with something, be honest about it. Say, I don't know. There's no harm in saying, I'm sorry, I don't know, or I'm sorry, I don't have experience in that aspect. You cannot know everything. You cannot have experience in everything. So it is perfectly fine to say, I don't know, or I haven't done it before. It's perfectly fine to say that. And another thing, at the end of an interview, you'll usually be asked, do you have any questions for us? It's always a good idea to have questions. The reason I say that is because it gives them the sense that, yes, you did read up about the school, you do have questions. But having said that, just because you need to ask a question, don't ask a question. Just anything that's on their website, like if it's that just shows that you didn't read and you're just asking the question for the sake of asking the question. So you need to be smart, you need to ask questions which actually you want to know, not just because you need to ask a question, so I'm going to ask that question. Yeah, so I think apart from that, yes, just stay focused, keep working towards your goal, and good luck on all of your preparations. I think we can go over the question and answers session now. I know all of you have posted some questions. We can start taking those questions now at this time.
All right. So one of the questions that was asked was, how do you compensate for low grades? Now, one thing that is a strong part of your application, or let's say an important part, is grades, yes, but that is not the only part of your application. Schools or admissions committee members are looking for students who have a good, holistic, strong background. It's not just about your grades. Every individual has their own strong suit. Some people might be really good at hand skills, but they might not be as good at reading comprehension or vice versa. You're lucky if you have both that are extremely good, which is when you end up with high grades and a good class rank. But these folks have been doing these admissions for quite a few years, if not decades. So they do know and understand that grades are not the only representation of an applicant, right? They do tell you something about an applicant, but irrespective, if you have a very low grade or a very low GPA, you can address it on your personal during your personal interview. How do you cover up for that before you get to the interview stage? How do you get to the interview in the first place? There are different things that you can do. You can either apply for a research position if you are over here in the United States, or even outside if you have research opportunities available in your home country. Research background definitely does give a good impression of who you are as a candidate, because let's face it, research is hit or miss, right? It also can get frustrating. So, and if you have accomplished something in the research field, then they do know that you do have the perseverance to push through and actually be able to overcome any challenges that you might encounter either as a clinician or as a student. So that's something that really reflects well on your overall application. The other thing that you can do to boost your resume is, again, attend CE courses. I think one of us did talk about it earlier on. I cannot stress how important CE courses are. They could be any CE courses, be it something that has to do with endo or perio or pros. There's no right or wrong over there. One course that you might want to specifically keep in mind is the basic life support course that is by the American Heart Association. It's for CPR. Schools do like to see that you have taken that course. Also, low grades during dental school can be compensated for if you do have further educational experience, if you have done a master's, or be it in dentistry or in public health. So if in case you do have low grades once, hopefully you don't have lower grades another time and you don't repeat that mistake. If, let's say, worst case scenario, if you have, again, there are ways to get around it, like I mentioned, by research or by CE courses. If all these things combined do not make you feel that you've done enough, what also can count in your favor is your work experience. Like Jyotsna mentioned earlier, it takes about 2 years for all of us to practically go through this entire process, where we take the national board exams and the advanced dental admissions test, which some schools have started asking for now. I don't believe it's a mandatory requirement. I may be wrong over there, But again, to go through all of these exams and then through the application process, make sure that you are working simultaneously. Because when you do go to an interview, right, work experience does matter. So all of these things put together can actually give you a get around uh, your low grades. It's yes, GPA is important, like I said, but it's not the only thing that schools look for. If you have other things on your application, right, they are going to call you for an interview. They will ask you as to why did you have that low grade. Let's say that you just weren't dedicated enough at that point in time. Be honest about it and tell them, I just wasn't dedicated enough at that point in time. That sincerity was something that I was lacking, and I've realized that and I've overcome that. And that honesty is something that admissions officers do really, really appreciate. If it was any other outside external issues that prevented you from giving your 100% during dental school, you can talk about that. But if I were you, I would just try and yeah, come around the issue of low grades, which I believe is a problem or a concern, I would rather say, that a lot of individuals have. I do totally identify with that because I myself do not have the best of GPAs, and these are the things that I personally did myself. All of them that I spoke about: research, work experience. I also did volunteering. That's something that schools like to do. If you are here in the United States, you can always join the American Red Cross. The Red Cross Society also has presence all over the world. So depending on which country you are in, if they do have a presence, make sure to join, contribute to the community. And all of this does make you a very highly desirable candidate to the school, or if not a very highly desirable candidate, at least a candidate that they would want to see in person. And then you have the opportunity to nail what you want to. Moving on to the next question, one of the attendees wanted to know about how would you talk about a stressful situation that you have encountered. Now, it does not have to be specifically related to dentistry. It could be a personal experience. It could be related to the profession of dentistry in itself. Again, what you have to keep in mind is that there is no right or wrong answer, right? Let's say you are a fresh graduate. You did not take 2 years, as most individuals do, to go through the application process. You took your boards part 1 during the time that you were in dental school. You took your boards part 2 immediately after you graduated, and it's only been, let's say, 8 or 9 months, or let's put it at less than a year that you've been a graduate from a dental school of your home country, and you do not have much work experience. So is there a possibility that you've had any sort of emergency in your experience so far? Maybe not. So you can tell them that with the limited experience that I've had, as far as professionally in dentistry, I haven't really encountered a stressful situation yet, but be it for good or for bad. If you want to add a touch of humor to it, you can just tell them that this interview probably is what I want to say is stressful because I'm really nervous, right? And it could evoke a good laugh so long as you put it in the right way. Or you could just talk about a very personal experience that you've had, be it related to your growing up years, or be it related to what you've encountered in your social life, or what you've encountered in your family life. So again, no right or wrong. They just want to gauge who you are as an individual and how you react to that to a stressful situation. So whether or not you choose to share one, or whether you choose to sidestep that question by adding a touch of humor, is again down to you. And irrespective, humor works well, an honest answer works well. So, yep, no right or wrong over there. It's down to you as an individual. But yeah, I guess that's what I have to say about that.
I like to add something to that question. So when I was asked this question, what I said was I gave an example of a stressful situation that I had, and I also said that how I worked through it and what I learned from it, and how I overcome that situation. Maybe something that said that it was really stressful at work, it got piled up, and then it was overwhelming. And I said how, I put a note of things and wrote it down and prioritized my work. And that kind of helped me through, stressful situation. Um, as Mohit said, there's no right or wrong answers to it. It's same goes for, when they ask what are your strengths or weaknesses, do we have to talk about dentistry, or can we talk about something that's personal? It's totally up to you. You can, say something as a humor. I said I'm really talkative. I don't give the other person a chance to talk, as you see, because I was talking a lot during the interview and they had a laugh about it. And, you know, anything works. It's just about an honest answer, something that you can, easily breeze through and talk to them about.
Okay, so one of the questions is, for bench tests, do schools look for clinically appropriate preparation, or it should be aesthetically really good as well? Arifa, do you want to answer that?
Yes, so I'll tell you about what they are looking for. They are not looking for preparations that are ideal. They are looking for you to make sure that you're not doing any gross mistakes. You're not making the adjacent tooth. You're not cutting the wrong tooth. You're doing something that's clinically acceptable. Just you're not looking to do anything that's exemplary. Just do something that is acceptable, basically. You do not have to go on and polish. You do not need to make sure that it's shining and it's pretty and everything. Just something that you would approve of. As far as you would approve of your work, you think it is going in the ideal, it is close to what it is required to be, you're going to be fine. We all know that we're going to be interviewing with people who are fresh graduates, have a good grasp of their skills, and people who've been practicing for years, have lots of experience, have been specialists in that, probably in that field, as prosthodontists are much better. I went in with that mindset, and I'm telling you, it's not a good idea to go in like that. I had a 2.5 year gap while just before I actually picked up a handpiece and started practicing for my bench tests. I was stressed out just by the thought of how am I gonna compete with people who have been constantly in touch with dentistry? How will I ever match up or compete with these guys? But believe me, everybody is just as stressed as you are. Everybody has worked as hard as you have. It's a skill we all have to practice. We all have to give ourselves time and patiently take your time, do as much as you want, as slowly as you want. You have enough time when they tell you crown preps, when they tell you class twos. As far as you've practiced, you'll be fine. Don't do any gross mistakes, and you'll survive just as much. I know
I'll just
go ahead.
Okay. Yes. I'll just add something to it. I think it's very critical that you think about the preparation. Always, never under prepare your preparation. Over preparation is always better than under preparation. Think about that your crown is not going to fit if it's under prepared. So always prepare. If you're not sure about it, make sure your shoulder margin is 1 mm or more than 1 mm. Look at the school requirement, because every school has different requirements. Like if you look at their manual, they will always tell you, the manual will tell you they need 1.2 mm shoulder. Some school will tell you they need 1 mm shoulder. So just look at it and make sure you have the right number there. Make sure you don't have undercut. So when you look at the bench test, they have some major errors and minor errors. Never do the major errors and you will get through it. Don't try to make your prep really smooth. Just try to make it very accurate, as Arifa said about it. Yep, that's pretty much it.
I
Thanks,
know I was
Kirti.
talking about, I'm sorry, I'm just going to finish up one more question that I was supposed to answer. I know somebody asked about what they ask on the bench test at USC. If I'm not wrong, USC in their email will give you a book of references that you should abide by as for guidelines. They do not send you, like USC, they do not send you a manual and tell you exactly what and how much and everything. I know Buffalo also sends exact information on what they want, but USC will not tell you what they're going to be asking. They'll ask you to prepare and come for PFM, if I'm not wrong, or class 2, and wax carving. They're not going to tell you what they will be asking you. They will definitely ask you a prep and a wax carving. I remember what I was asked for was a tooth prep. I'm sorry, I do not remember what prep it was. And it was a wax carving of, I think it was a vase or something they asked us to carry. There are different types of wax materials, wax blocks that are available. Some are a little coarse and some are more waxy, if I may say. Just try ordering a few. You get it in a packet. I had ordered mine from Dr. Tools. Actually had mine picked up myself from Dr. Tools, and I worked on a few types. Figured which one works best for me with the carver and everything, which is easier to carve. And it's really simple, actually. As far as you enjoy doing a little artsy stuff and artistic stuff, you'll be fine. So that is what USC will do. It's not too stressful. They'll tell you exactly what they want.
Thanks, Arifa. I just want to mention that we're going to try and answer as many questions as we can, as much as time permits, but we will get to the other questions after the webinar. But I just wanted to go over one question which says, do I have to change my personal statement every cycle if I'm applying to the same schools? Well, think about this. Your personal statement is talking about why you got into dentistry or what your motivation was to come to the US. It's personal. It's your personal story. Your personal story is not going to change from one cycle to the other. So technically, your personal statement should not change. Like the content should not really be, you can't say that I wanted to do dentistry because of A, and then the next year you say I wanted to do it because of B, because, well, that's not consistent. But yeah, you can definitely change how you put it forward. Like you can, change the English, you can change how you present it, that for sure. If you're talking about what you've done in the entire year from like the first cycle that you apply to the second cycle, of course that will be an addition in your personal statement. So do you need to like revamp it completely? So what happens is that when you look at your personal statement again, I really believe that a personal statement is something that you should work on for a long time. It shouldn't be something that you work on today and submit it tomorrow. It should have multiple reads. So yeah, definitely you can change how you present it, but the content should actually be the same if it's your story. So that's something to keep in mind. So another question that was there was, what kind of questions should be asked to the interviewer, if any? Jyotsna, do you want to answer that?
Sure. So you know why you're applying to a particular school, right? You can maybe, if research is something that you are going for and it's a research oriented school, then you can ask questions like, what kind of opportunities do you get? How are they funded? Or is there any honors program to do research? And when I applied to Penn, I knew that there was going to be an honors program in research, and there was a honors program to treat medically complex individuals. Certain things they already have in their in the website, but if you want to know something more about it, you can always ask. Like if you want to know a school accepts takes allows you to take NERB exam or a REB exam. NERB and REB are the exams to practice in different states. If someone doesn't know about it, you can ask that sort of questions. Or if you are somebody who wants to volunteer in community a lot, then you can ask questions like, do we go to get to go abroad to do some kind of volunteering work through school? Or you can ask about digital dentistry. Do you guys let the students, get an experience on digital impressions or CIRAC? Or questions like, do you get to restore implants? Something regarding something that's not already in the website. Don't try to ask something that's in the website that clearly, is put forth for you. If someone wants to add to that.
I'll take over Josna. I agree with Josna, and then I just want to add, if you want to add a humor to your, interview or anything, or you want to ask the interviewers anything, you can always ask them, what are you looking in an applicant? Like, they can always give you some suggestions, and then you can actually work on your application after that. It just gives you more idea. And I will go over a question being asked about UCLA. UCLA, as far as I remember, it was a benchtop exam, and then they asked one class 2 preparation on a molar, which is pretty basic, and they ask you PFM preparation, or I think it was all ceramic preparation on number 8 or number 9. They give you a manual, just read through it, follow whatever they have mentioned. If it's 1 mm shoulder, make 1 mm shoulder, use probe, make sure you don't have undercut, and make class 2, make sure your contact is open. This is what basically they are looking at. Interview in UCLA it's actually, there are 2 interviewers, and they ask, it's a very normal interview. They ask about your application, your life experiences. They ask you, why do you want to come to US? Pretty basic. And then I would like to touch base upon ADAT exam. It has been introduced recently. Many of the schools don't need that exam right now, but I recently heard that University of Michigan is going to start that. They have actually mentioned on their website that they will be taking ADAT exam from the next year. So my advice would be to all of you, always check the university website before even asking a question to different people. You will get a lot of information if you look at the university website. So do your homework well. It really makes a lot of difference. Do your homework well. Look at all the university websites. Look at SPM. Make a note of it. What are the school requirements? What are the bench test requirements? Which school needs part 1? Which school needs part 2? It does make a lot of difference in your preparation. And then regarding the CE courses, there is no specific number, but then Indiana recently started a number, and it's, I think, 300 hours you need to complete in order to apply to Indiana University. So just make sure that you read their website. Like, the application starts in March, but they always update their website in February. So just check their website and see what are the requirements for this year, because they always change their requirement every year. Yes, that's pretty much it. I will hand over to Anchita now.
I want to
Thanks,
thank everyone for attending tonight's webinar, and then I definitely want to thank the panelists on an excellent webinar. Just to remind everyone, this webinar is recorded and will be provided to all the registrants by the end of next week. Thank you very much. And here is the email should you have any additional questions. Everyone have a great night. Thank you very much.
Thank you.
Thank you. Good luck, people.
Good luck.
Thank you. Good luck, everyone.